How does follicular lymphoma transformation affect patients? Imagine living with a slow-growing lymphoma that seems manageable and steady. Now picture that suddenly changing into a more aggressive disease. That's what happens when follicular lymphoma transforms. This transformation usually turns the disease into a more aggressive type called diffuse large B-cell lymphoma. It's a significant change that impacts how the disease behaves and how patients experience symptoms. When follicular lymphoma transforms, the cancer cells start to grow faster and become more aggressive. Patients often notice rapid swelling of lymph nodes or new lumps that appear quickly. Sometimes the disease spreads outside the lymph nodes to other parts of the body, which is called extranodal involvement. Symptoms like unexplained fever, heavy night sweats, and sudden weight loss can suddenly become more intense. Patients might also feel weak or tired more often, and blood tests may show elevated markers like lactate dehydrogenase, indicating more active disease. Diagnosing transformation can be tricky. Doctors usually need to perform a biopsy of the suspicious lymph node or mass to confirm the change. Imaging tests like PET scans help identify areas of high metabolic activity that suggest transformation. Often, a sudden worsening of symptoms or rapid disease progression raises suspicion of transformation. The prognosis after transformation is generally less favorable than with indolent follicular lymphoma. Survival times tend to decrease significantly, with median survival ranging from about 8 months to 2 years after transformation. Some patients who respond well to treatment and achieve complete remission may live several years longer, but overall, the outlook is poorer than for those whose lymphoma remains slow-growing. Transformation is a major reason why some patients with follicular lymphoma face higher risks of mortality. Treatment strategies also change when transformation occurs. More aggressive chemotherapy regimens are usually needed, similar to those used for diffuse large B-cell lymphoma. The addition of targeted therapies like rituximab has improved outcomes, but the prognosis remains worse than for indolent lymphoma. Early detection of transformation is crucial because it allows for timely, more intensive treatment, which can improve the chances of better outcomes. Monitoring patients closely for signs of transformation is essential. Doctors watch for rapid symptom changes, new or enlarging lymph nodes, or worsening blood test results. Transformation can happen at any point but is more common within the first few years after diagnosis. Although the risk decreases over time, it remains a concern for long-term survivors. In summary, when follicular lymphoma transforms, it changes from a slow-moving disease into a more aggressive and dangerous condition. This shift leads to more severe symptoms, faster disease progression, and a shorter survival outlook. Detecting transformation early through biopsy and imaging, combined with prompt and more intensive treatment, can help improve patient outcomes. It's important for patients and healthcare providers to stay vigilant for signs of transformation and adapt treatment plans accordingly, always seeking personalized medical advice tailored to each individual situation.